Digi Wufia Saman Ampa Mijani Namawu Dena Waswamami Oh Ampa Miswani Namawu Dena Waswamami. Amen.
Amen. Sarah Nyankopon Israel. And yanom yema obi biara akwa ababiom eba michiana women's ministry a meeting and nedai mestre say obi biara baby biara baba miuti oho kama Yonkodoradio TV yema wakwa abakwan sonko so mestre say yebe share baby biara ko YouTube a obo Yonkodoradio ana TV a obenya michiana obenya na ya share na obi susu enya bi ahwe yakraje ebia untimi nka nyame asem enkyere obi nenso ubefa kwan yi so na warechi obi na share adidi animunyam emu bibiara akwa aba enedai so yen sebre ne yebehwe Mama Stella Fosu na wode ye Bible akenkan na abrayen na yewia de ewo ho ne yato aso. Mpacho wa mute wo.
Ipamcha mo mayentie Erade asem na yakenkan asem a yensofo maame ebegyina so ede akye ade no yebehu afi 1 Corinthians chapter 6 verse 19 and 20. Korintofo nwoma edikan tinsia nchichemu dum krone aduonu. Ose munim se muni pedua ye kronkron a etimumu a Onyankopon na ode ema mesisubi munim se muni pedua no ye honhom kronkron a Onyankopon na ode maamo no asori dan na munim ho amchewo na kore bi hame insan start bi mpamchewo osimu nim se muni pedua na etimu muni pedua no ye hom kronkron a etimu mu a Onyankopon na ode maamo no asori dan na munim ho otomo aboden entimu fa muni pedua no enhye Onyankopon animonyam Erade asem nie. Amen.
Amen. Ma Onyankopon insha enuanom yene Onyankopon nam na adom ebradom nyina so no ede na adom ye no ayesofu maame Dr. Patricia Ochre sofu maame Patricia ewo kunu baako ni kunu ye osofo Israel Ochre nyame adom last week ye ono so bedom ye na me de ne che na omo emame ensa Kofi Kwame ena Lillian enunti ene ono na Onyankopon de adom de na adom yen se ne yedwumadi no oni anim ye wohia sabre ya na se obekai sof maame wo empaibo mebra obekyerekye yen tie ni ye na owi a bema ye kwan ame ye bisa de epese ye bisa bia na aboa meni emienu Erade inshaye na omaye yokodro muhum midimunti. Amen.
Amen. Me patrol muhu mi screen no.
On pachane.
Okay, perfect. All right. Memobia, good evening. First of all, me pesa media sidake sie Emma and Women's Ministry leader, Sister Bernice, and Women's Ministry for Nina. And additional, it's about a class of medication. It has become very popular on the market. Me assure say what's it nidin krada. Now the class of medication only the GLP-1 RA medications. Now, a lot of people use it for weight loss without knowing full information about adrenal. The presentation is to help us navigate beyond the trend, what they are talking about on social media, the popularity of this medication. We need to know exactly what this medication does so that we'll make the decision, you can make an informed decision whether say obefa adrenal and now say you will do something else. So that is the purpose of this presentation. We will talk about the rise of GLP-1 medications. We'll talk about what they are, the types, how the benefits, and then the side effects, and then we'll also talk about the risk and other complications with the medication. So lately, if you've been paying attention in the news, there's a lot of celebrities out talking about, we're losing weight using this injectable drug. I think that the most popular one, a lot of people know, Oprah Winfrey. Oprah Winfrey came out, one who said we're losing a ton of weight. She actually came out and she says that she used this specific drug to lose the weight. There are other celebrities talking about it. TikTok, a lot of people are talking about say they lost weight using Adrobia or they want to lose weight. So before I start, I have to put this disclaimer there, and I'll read it. The information provided in this presentation is for educational purposes only and is not intended as medical advice. Please consult with a qualified healthcare professional for personalized guidance and treatment options. I do not assume any liability for actions taken based on the content of this presentation. So the American say information I may share with you, send a photo and I say a addition and it's not intended say it was a offer Jamaican. Say wouldn't say being on this medication, make sure you talk to your healthcare professional and now say Obia or show now wabeki a personalized treatment option at a bebwa wankasawumu. So before I talked about Oprah Winfrey. Oh, her picture here, she has lost a lot of weight. Oh, her baby, I know she sweater pink to the purple dresser will lose a lot of weight. And then she came out and she says that she used a specific medication called Ozempic. I'm sure, so we TV prime time between 8 and 9 p.m. You will see all these drug commercials, and I'm sure so we Ozempic. They talk about Ozempic. It's a very popular medication. Oprah came out and says that she used it to lose weight. Another celebrity by the name of Harvey Feinstein. And also you can clearly see we had the first picture now. Who said not also but you look at the second picture, one who said he lost weight on this class of medication. Another one, Elon Musk. I Tesla cars, We had the picture on the left. Not Nimuyeju. This past Christmas, he took a picture in his Santa Claus suit, like a slimmer version of him. Also, he has also come out to say, to lose weight. So with the popularity on social media and celebrities coming out saying that it has made this drug very popular. And in the pharmacy setting, we have seen an increase of over 2,000% in prescription between 2019 and 2022. So in 3 years, the prescriptions that you receive for this particular class of medication has increased over 2,000. And then 12% of US and paying for. And so, like I said, they have taken this medication at one point in their life. About 43% of patients are more type 2 diabetes, and so HS are almost so far adrenal. And a 22% increase in patients are overweight, and I say they have been diagnosed with obesity. So, what is it? So, GLP-1 RA medication. GLP stands for glucagon-like peptide 1 receptor agonist. And I'll come to this. We will break it down. It's also a specialty drug. It's a self-injectable drug. Pharmacy. Depending on which medication you may inject once a week or you may inject every day. And so FDA, Food Drug Administration in the US, when research come up with this medication, approval medication for 2 disease states. Number 1, type 2 diabetes, and then number 2, for obesity. So with this class of medication, they are glucagon-like peptide 1 receptor agonist. They are specialty drugs, self-injectable, and it's approved for type 2 diabetes and obesity. And it's a very expensive medication. So we will be a insurance, like prescription insurance, over pharmacy. I know some people they come to the pharmacy and they pay out of pocket for this drug. It be $3,600 a month just to be on this medicine. So it's a very expensive medication. There are different types of GLP-1 agonist medication. They're money different. All of them can be used to lose weight, but there are specific one at FDA design. Say this one is supposed to be used for weight loss. This one is supposed to be used for type 2 diabetes. Even though the one for type 2 diabetes, you can still benefit from the weight loss property of this medication. So how do they differ? They are different from the way you take it. Like I said previously, you inject once a day. Another one, you inject once a week. Like how often you take them. There is one, so far on the market, on the US market, there's only one GLP-1 medication you take by mouth. So you take tablets. All the other ones, injectables. And then, like I said previously, in which disease states are over medication. So we have a short-acting and we have a long-acting ones. The short-acting ones you take on a daily basis, and then the long-acting you take on a weekly basis. And for short-acting, you have a drug to say Byetta, Victoza, Saxenda, Ribelsis. Ribelsis, is the only oral GLP-1 medication in the US has a. And then when you come to long-acting, you have Trulicity, Bydureon, Ozempic, Wegovy, Mounjaro, Zepbound. Now, out of these medications, the ones that are approved only for weight loss, Wegovy, Zepbound, and then also Saxenda. So these 3 specific medications, are the only one approved for obesity. But previously, like I said, celebrities to say Oprah Winfrey, Harvey Feinstein, Elon Musk, they came out and said that they were on Ozempic, which we can clearly see that Ozempic, is specifically designed for people with type 2 diabetes mellitus. But it also has that property. All these medications, now you're obese, it will make you lose weight. But the indication and the approval from FDA, may be different. So exactly how do this medication work? Then a year our body more. In order say GLP-1 arsenal, we need to understand say Onyankopon bo ni pediano. Onyankopon naturally obo hormone be where your body. When I say hormone it's a chemical be anyame your body more. It sends messages to other parts of the body for those parts need to do something. And so Nyankopon boy naturally oboyen with a hormone we call GLP-1 hormone. Now, so hormone you can only find it in your small intestines. Now, the way Nyankopon boy sa hormone, it has several again yema bebre. And yema bi aye say udidi we are say aduane to yemo hormone no sa GLP-1 na wo intestine no like on suno ketwa no it release when it release it communicates with or organ be a friend the pancreas. Now the pancreas is responsible for producing insulin. And so this GLP-1 hormone, no communicating from a small intestine to your pancreas and tell your pancreas to say, oh, Adriania, we need to release insulin. And the purpose of releasing insulin,
what you need to do is
to make sure,
give me the I'll get the routing information from both.
Patrick, can you mute yourself, please? The insulin will allow glucose. So when it breaks down into glucose. The glucose stays in your blood. Insulin needs to go and take the glucose out into the parts of the body in here glucose to work. And I said in here glucose to use as an energy. So that's one of the functions of GLP-1 hormone. Another one, it blocks something called glucagon secretion. So glucagon is also another hormone that your body. No, nejuma awaye no oye nejuma ni opposite of insulin. Insulin aduane ba na wakoyi moja no wakoyi glucose no every moja ni mu. Now glucagon you say aduane accommodate. Let's say you are fasting. Oh, fasted. The only reason why you are able to function while you're fasting no is because it say there's a storage of glucagon. Ewa will liver mu. In the liver no say aduane ni wo yemu because you need to walk, because you need to think, because you need to be able to talk and do all of that, your body starts secreting glucagon no into your bloodstream. So your bloodstream no glucose will go up. So it works the opposite way of insulin. So the GLP-1 and Yankopon boy naturally a block glucagon secretion, which means say a commodel. Now say GLP-1. I'll come back to that. It will make sense when I talk about receptor agonism. The another thing they say slow your stomach emptying. It's a GLP-1 naturally. Then Yankopon the boy a bit slow with stomach emptying. It will take time for adrenaline to digest in your intestine and secretes the glucose slowly into your bloodstream. That is the work it does. And then another thing they say GLP-1 adrenaline beto yemwa. It hormone communicates with your brain and it tells your brain say, my main my main means me NGBO. So that is the communication that it gives you. So 4 things. The first one, it trigger insulin from your pancreas, and you will have low blood sugar in your bloodstream. Number 2, it blocks glucagon secretion. Glucagon say a comodewa, a bema hormone will trigger so you can produce glucagon, which will raise your blood sugar. Into GLP-1 nejuma no e blocko sa glucagon ebema sugar ako high no, and then it slows the emptying of your stomach. The release of glucagon into your bloodstream will be low. And then the last one is that it makes you feel full. These 4 things are the natural thing. The GLP-1 naturally na yankopon de maye ne nejuma oye no. Medications here or matunidine GLP-1 receptor agonism. So what it does is say obroni tenase and obroni say okay. So nyankopon GLP-1 no the boy say yes I way in idea. And then yen try say yen shebe produce be etisa. To say call lab no they came up with something that is very much like the Nyakopon de Maye. That is why the GLP-1 stands for glucagon-like peptide 1 receptor agonist. In medical terms, when we say something is an agonist, they just say BBA. It achieves the same results as the natural occurring substance. I'm trying to me debeba tree amana akofem kakra, but a idea ye design something that has been manufactured. So adibi obiya ye ye pese it produces the same results to say the natural one na nyankopon edi aboye no. So in other words, GLP-1 medications, what it does, they say, it does the same role, the 4 roles we talked about. I say GLP-1 natural one, the GLP-1 receptor agonist also does the exact same thing. And it is so obi because naturally you obi esa what sa edron, especially those on high doses now. You are adding on to the effect and can naturally if I say naturally 10% with GLP 10%. You are adding more to it. It is 10% because you are injecting more. You are probably making it be a 40 to 50% more. It does all 4 things that you can, insulin secretion from your pancreas, blocking glucagon from your liver. The third one, I think it's making you feel full. And then the third, let me go back. The stomach emptying, slowing stomach emptying, and then communicating with your brain, say, one main. So the GLP-1 agonist, which is in neural markets, that is what they have been designed for. But for the purpose of this presentation, we'll talk about obesity because that is what a lot of people are using this medication for. So clinically, you can be obese. And just the BMI, the body mass index, 30 or higher. So these medications are designed for people with obesity to BMI 30 or higher. And now said we are overweight, and then you also have other health complications. And that's other health conditions. It's diabetes. You have, coexisting conditions. You have some cardiovascular risk. Those things, So if you go to your primary care physician, normally they will assess this. If you only qualify because you are obese, then there are specific one they need to put you on. If you qualify because you are overweight, which is a BMI of 25 to 29.9, and that's diabetes, and then you are overweight, then they will probably put you on something like Ozempic, which helps with diabetes and weight loss. So you get a combination of these medications based on a condition. And then what are the potential benefits and risks? I'm trying to go quickly, so if you have any questions, we can ask. What are the potential benefits of GLP-1 agonists? It helps lower your blood pressure. The reason why it helps lower your blood pressure is because if you lose weight, there's not too much pressure or anything that heart no need to do. So it decreases your blood pressure. It improves your lipid disorders. It's all with lipid panels. Your LDL will come low. Your HDL will be high. Your triglycerides will be low. So it talks about all of these things. It helps with all of these things. It also improves fatty liver diseases. So people with fatty liver diseases, they get benefits from taking this medication. It also reduces your risk of heart disease and kidney disease. As a matter of fact, if you look at the studies of these GLP-1 agonists now, they see a tremendous improvement in people with chronic kidney disease. So it has some level of protection or regression for people who have chronic kidney disease. So it's a fairly new medication on the market. So a lot of research are coming every now and then. There are new research and new findings that are coming. It also delayed the progression of diabetes-related nephropathy. So people with chronic diabetes, the nerves, now they don't feel anything or step on something sharp or feel it. This medication is known to delay that progression. To diabetes now, you start this in a good time frame, the chances of you being nephropathic, will be lower. Okay, so what are the side effects? Let's go over the common side effects of GLP-1 agonists. Number one, loss of appetite, because you don't feel like eating. If you remember, the GLP-1, it communicates with your brain and tells your brain you don't feel like while you're taking this medication. Nausea, vomiting, and diarrhea. I want to talk about nausea. Nausea is one of the biggest side effects and the biggest complainer we have with this kind of medication. And most of them, it starts at the beginning, like you will experience this nausea. But the more your body gets used to a specific dose, then the nausea decreases. But immediately when they increase your dose, because some of these medications, you start from, I'll give you an example, like Ozempic. You start from 0.25 milligram for like a month, and then you go to 0.5 milligram, and then they increase you up to 1 milligram and 2 milligrams. So the potential of you going up, but every time they increase your dose, you have the potential to experience this vomiting. I mean, not vomit, the nausea. You have the risk of experiencing that. So that is one of the most common side effects of adrenal. Other side effects, dizziness, mild tachycardia, which is an increase in your heart rate. You have infections, headaches, indigestion, and then also you may have temporary itchiness, and I'll go over that very quickly, but let me talk about the infection. A lot of people get infection because of the way or more administered medication. It is self-injectable. One, I'll be injected into you. Want to make sure that if you're on this medication, you are cleaning the site of injection with alcohol and you're injecting it right. Band-aid so just to prevent bacteria or anything to go in there. So infections, it's mostly because it's the way they're injecting the medication. They're not checking safety measures to do the injections. Another one, a headache, indigestion, which is upset stomach, and then the itchiness. Itchiness, can be due to the fact that sometimes, because this GLP-1 so close to the natural one some people's body will still be able to determine say it's a foreign thing. Like bodies need to especially those with immune compromise. Their body can detect that no, this is a foreign matter coming into my body. In the injection sites, when we say the itchiness, there's redness of the site of injection, an allergic reaction. The most severe, but very rare to see side effects, pancreatitis. You can have inflammation of your pancreas, medullary thyroid cancer, and usually common in people with family history of medullary thyroid cancer. And then you have GI issues, and I'll come to that. You have acute or sudden kidney injury. And then you have also worsening diabetes-related retinopathy. So diabetes complication about your retina can be affected. So you end up getting glaucoma. So they've seen, say, people on this medication can get worsened retinopathy being on this medication. Now, the GI issues, the gastrointestinal issues, I want to make about gastroparesis because it's very common, especially people who have been on this medication for a very long time. Because I say, adrenaline makes you feel full, days and weeks, not adrenaline and 20 and so we will be fasting a lot. when you fast for a long time, and they always tell you, say, oh, break it fasting now. You need to start with like a liquid liquid food. You need to start with liquid food. Send your baby will intestine and I said one no. How do I explain this in Chi? Because it can your insulin cannot, it can tie itself. So because of the fact that this adro does not make some people feel hungry and they go days without food maintenance. So one day or the adrenaline tony yemwa, no, it's me paralyze it. So you have gastroparesis and no will tie into knots and that will kill you immediately. So or pharmacy, one of my clinical advice to them is to make sure that even if you don't feel hungry, make sure that on a daily basis, you eat something healthy. Force yourself to eat something healthy. Send your intestine will know, say, okay, aduane kakra abetomiyem. And yes, when you go long term without eating, your chances of getting gastroparesis are very high. And then another side effect is what we have termed Ozempic face. It's called Ozempic face because Ozempic, is the most popular GLP-1 medication out there. But all the other ones, Saxenda, Byetta, Bydureon, Mounjaro, all of those things, will give you Ozempic face. So the Ozempic face, when you lose weight rapidly, sometimes I'm able to tell, say, nipa way or the GLP-1 medication. So based on how it's here. So people who are taking this medication to lose weight, you see, say, or more, they have a hollowed look on their face. I said, or whole bisa. There's changes in the size of their lips, their cheeks, their chin. You see some wrinkles in their face, and and then when you see their jaw area and the neck now, we almost said the skin, it's hanging, like it's sagging. So normally, people they lose weight so rapidly on this medication, but a lot of people those who are doing gradual, like they stay on one dose for a long time before they increase to another higher dose. You see, it's not noticeable, but lose so quick. It's easy to spot because that's why we call this Ozempic face. And then people with Ozempic face or more very severe, like celebrity name show the second one, Harvey Feinstein. Or no, they say you cannot reverse it unless they say, plastic surgery to tighten the face up. And this is a side-by-side picture of the Ozempic face I'm talking about. You can see the lady on the left side, very plump face. And then on the right side, this is the same person. It's sunken. You see a lot of wrinkles. So when they call a wrinkle, and you see the lips, the lip so as a sakakra, and when so a shape as a sakakra. So what are the risks and complications? 42. Okay. Risks and complications. I think I've already said that some people will produce antibodies. They will see the medication say a foreign body being about a body, so they'll produce antibodies against the medication, which is an allergic reaction. So my allergic reaction is just on the site of injection. It is so severe, say they need to go to the emergency room immediately, which we call anaphylaxis. So anaphylaxis, if you're on this medicine and you start experiencing shortness of breath, of wheezing, and I say, and all of a sudden you have hives, you won't mean swallow because your tongue is expanding now. And I say, severe pain in the belly or chest and also tightness, or you feel like I said, BB Asha was so kind of things, maybe you need to stop the medicine and immediately go to the emergency room. So there's studies when they use the medication on a woman pregnant, when a woman had the baby, the babies had abnormalities. Right now, it's not safe to use this during pregnancy. So if you are using it and you become pregnant, immediately you need to talk to your doctor and maybe come up with a different treatment regimen for you. And now say, if age a possible say I get pregnant while you're taking this medication, find a secondary way to prevent yourself from getting pregnant while on this medicine. Okay, so quickly on hypoglycemia, a lot of people are diabetes, they are taking tablets, it will have metformin, they are taking other sulfonylureas, like other class of medications, Those medicines have the potential of decreasing your blood sugar, which we term hypoglycemia. It's all the GLP-1, those tablets, the risk of obia or diabetic, hypoglycemia, high. We ask that we say so now you're diabetic. Now you are taking other class of medication and be watchful for these things. And when it happens, to seek advice or go to the emergency room. Maybe Bessie here, I know that we have about 15 minutes for questions. So we'll open the floor for questions. About your Obi or question be or Hana. Obi, a new question in here. I did very well in the presentation.
No question.
Okay.
My pacho. Okasano, as a man, the Enkwana, okay. Into my perception, said, does it have side effects on the member swana? And ten a brains, you have a boy home by. May I hold the answer by? But that's it.
Okay, that's a good question. And member, when I was doing the research, I looked into, say, if there's a potential of affecting a member, a reproductive system. I did not come up with anything, but that doesn't also mean that it's not there, because these adrenal, they are fairly new on the market. It has gained so much popularity. Say they are playing catch up. They are playing catch up with adrenal to research more into it. It's for now, Nadia. There's nothing that has been published that says to say Bema Eusubia, it can affect Bema no a reproductive system. I did not come up with anything. But yes, a Bema equally can take adrenal to say the Emma and so Effa adrenal. Yes. Good question.
My second question, so now Metisa, I say why am with Afano on a longer time, Noyana. Side effect or mobile tau ayampa.
Not so omotewu, but long term, no. If you are on this medication for a long term, ujaya that not so. If you don't include lifestyle modification, say bia you live a sedentary life, only exercise, you're not eating right. Let's say you have lost a lot of weight on this medication now. You will have to be on this medication long term to maintain that weight loss. Because if you get off of it, now we resume your sedentary lifestyle now, you are going to gain those weight back. So people who are on this long term, the potential of them being on the medicine for a longer time because they want to maintain their weight, high. Unless I say from the beginning of the medicine, you decide to say, okay, I truly want change. I want to eat right. I want to make sure that I'm eating right. I want to exercise with this. into coming off the medication will be easier because you have now adopted a new lifestyle. A bit more maintaining the weight now we're losing.
That's it.
Okay.
That's it. We'll answer my question.
Okay. Actually, any other question there? And as a baby or honma, I can also do that. Because I know that I was rushing, time was not in our favor. Okay, there are no questions. All right. I guess Sister Bernice, there are no questions.
Okay.
Okay.
I say, the topic connect to one will be testing me so question, but to see our testing me so what clear it out.
Okay.
And, I think say nipi I okay. Me testing me say we miss a question now, so what clear it out.
Okay.
I believe say a lot of people so any answers or more doubt into that's why
questions. Before I go, I know say Obi Busa me question be a lot of questions I get from people that they are considering some best at Bruno. Is it necessary say me Bruno and I say I should focus on exercising to lose the weight. I always say when you come to that point, you need to assess the risk versus the benefits. So let's say or diabetes, chronic diabetes, it's not very well controlled. You are heading to other complications, to say neuropathy, retinopathy, you have other cardiovascular diseases to be. Now, you need a quick turnaround. I think that if you weigh the benefit and then the risk not benefits, you're more than the risk now, go for it. But if you weigh, say the risk, you're too much for you against the benefits now, then don't do it. Then you go the traditional route, exercising, losing weight, and all that. But there's nothing wrong to be on this medication if you truly need to be on it. But don't just get it because I say more lose weight without looking at the whole picture of this medication. That is the whole purpose of this presentation. Another one, I know that there's a lot of GLP-1 on the market. When adrenal popular, there were times in the pharmacy it was on back order. You can't get the medicine and people are demanding the medicine, but we don't have it. So FDA gave an approval for compounding pharmacies to compound adrenal for people. Now that adrenal is back on the market that compounding FDA approved, it's not in place right now. But yet, people are still buying it off of the market. So if you truly need to be on this medication, see your doctor, let your doctor prescribe it for you. Go to a good pharmacy and get it filled. Because there's a lot of GLP-1 on the markets. You can actually go online and search and buy some from other countries. But keep in mind, they say, this is a medication that you are injecting into your body. Once it goes in your body, you can't take it out. So you want to make sure that it's something that is sterile. Because you don't know the condition contaminating on all the bro. So make sure that if you need to be on this, you are going, you're using the right route, to get the medicine. So that is all I wanted to say.
Okay. That's it.
Amen.
Okay, say bring a stress of Mami Sarah Kese. Now the closing song no amaye na yeah. Okay. So for Mama Sarah, and you're ready. Answer now, you will take announcement. Okay.
All right. So for me, I'm sure what this year would be my
Amen.
Me saying, in cry say, a baby best one. Ready, ever be fine, at the accost, so the bisham as soon as so. I don't see me, I'm singing 4-3-2. 4-3-2. Shall we gather at the river? So ye bisham so no so. Nya bofu atietia esu krojina esinda vinya mia ingwanumu you bishama suno so esu fefe no vinya mia ingwasino Yeni yahutefu beshem Esu fefeno anu ho Nyani suse shanshenu Ye benanti ho asu Dawo ahuto danu Moma yantu yaniswengu asana yadrusruho yeho numbenya odom ma yenyanta dinichel Erinchena ye betruho akwentu itu betra awose beka yankuma odo asum genyumu you Ye beshiva so no so asufefe no every nyamia himwase no ye ni yahutefu beshem you ye beshiva so no so asufefe no every nyamia himwase no yeni autifu beshem. Amen.
Amen. Amen. Shouts of Mama Sarah. Yo yanche hono ye be pray ye na ye first lady. So for Mama Kausa. Na wabeda so for Mama Oche ase amaye. Ansana de obia yede apa.
Yo, ebusuafo yɛbɛda ɔbɔ adeɛ no ase paa yie sɛ ɛnɛ nso wama yɛn akwanya ɛma yɛsua adeɛ te sɛ sɛ sɔfo maame Patricia Ɔkyere nyame ɛnhyira wo bebree na ɔntrɛ wo hyira mu ɛmma wo na afei ɔnom with enimdeɛ bebree sɛnea ɛbɛyɛ a wobɛkɔ so a na wode ayɛ n'adwuma yɛni asɔ paa sɛ yɛto nsa frɛ wo no wampopo wɔ ti na de Nyankopɔn de adom wo nimdeɛ ɔde adom no odi bi abɛkyɛ yɛn yɛni asɔ nyame nkɔ so anhyira wo ɛne wo fie ɛmma yɛn ebusuafo a mo nyinaa mo baa yɛn so no yɛda mo ase paa yɛsrɛ Nyankopɔn hyira nso ɛmma mo sɛnea ɛbɛyɛ a ɔsoro akwantu a yɛtui ne nneɛma a yɛsuasua yi ebedi aboa yɛn nkɔ so a mommra saa na yɛwɔ gyidie sɛ daakye yɛn nyinaa heaven ɛbɛyɛ yɛn dɛ nyame nhyira yɛn nyinaa ɛwɔ ne din mu nti yɛda mo ase amen.